is today. Making healthcare affordable and accessible one zip code at a time. Prince George's County has opened the first of 5 medical facilities in neighborhoods they are calling health enterprise zones.
The Global Vision Foundation opened yesterday in Capitol Heights. That zip code is 20743. Now, the goal of health enterprise zones is to enhance services to reduce health disparities among racial and ethnic minorities or in underserved communities. Now, here's Sarah.
Thank you, Allison. All right, we set the clocks forward this weekend, and that means a lot more daylight, but also a disruption in sleep patterns. It can be more than just an annoyance. Lack of healthful sleep can also do a lot of damage to your body and your mind as well. And joining us now is Dr. Neal Maru, Director of Integrated Sleep Services in Northern Virginia. Thanks so much for coming in. Sleep is a big topic right now. There's been so many studies and so much research that's been done. It just seems as of late. And it's Sleep Awareness Week, right in time with daylight saving time.
Absolutely, yep.
So what are the risks that people need to know about? A lot of times you just think, oh, we're a little bit tired, we'll have some caffeine, we'll be fine. But what are the health risks we need to know about with it?
So short-term daylight saving times, most people adjust completely fine. It's a 1-hour shift, just like taking a plane flight, 1 hour across a time zone. People normally adjust just fine. The problems we run into is when people have trouble sleeping or feel sleepy during the day on a long-term or chronic basis. And usually that can be due to inadequate quality or quantity of sleep. And that's when there's really an issue and can lead to long-term health problems.
What kind of problems are we talking about? Like overall, just heart disease, I think, is one. Give me a rundown of some of the issues.
So heart disease, of course, things like hypertension, cardiovascular disease, heart attacks, strokes, those kind of things we know about. Inadequate sleep can also lead to insulin resistance, which is something that can lead to diabetes long-term as well. In addition, some new evidence and things that we've known for a while also suggest that poor sleep can lead to, or at least be correlated with, depression. Chronic pain can be correlated with poor sleep, as well as even cancer growth.
That's the one that really, I think, is surprising to a lot of people.
So some new research showed that that cancer cells actually grow faster and tumors grow faster when sleep is inadequate, and that was surprising in a way, and certainly a focus for future research to figure out exactly what the mechanisms are behind that process.
If that doesn't scare you, I don't know what will, in order to get more sleep. So give us some tips on, and maybe not even just this weekend, but also this weekend with the 1 hour we're going to lose, but just overall of how we can be more proactive with this.
So first, the 1 hour, like I said, most people should adjust just fine. If you think you might have difficulty, or if you think, if you can think back to times when you've crossed time zones on flights, think about going to bed a little bit earlier tonight, and that'll kind of set you up for tomorrow night's shift and loss of 1 hour of sleep. The other thing people can do to help shift their sleep earlier is to get exposure to bright light early in the day, and also avoid light later in the day. That can kind of reset your circadian clock, so you'll be ready to go to sleep a little bit earlier for tomorrow. Long term, I usually recommend people stick to a schedule, a very strict schedule, especially if they're having a tough time either getting to sleep, staying to sleep, or feeling sleepy during the day. Get up at the same time every day. Go to bed at the same time every day. Make sure that you're getting 7 to 8 hours of good sleep a night. If you're not getting 7 to 8 hours, it may be time to bring that up with a healthcare professional.
Right.
If you are getting 7 to 8 hours of sleep and still feeling sleepy or tired during the day, that's also an indication that there may be poor quality of sleep, even though the quantity is okay.
You need to take it seriously, that lack of sleep.
Absolutely.
Thank you so much, Dr. Neal Maru with the Integrative Sleep Services of Northern Virginia. Thanks so much.
Absolutely.
Appreciate it. Stephen Allison, sleep. Don't we love it so?
Well, when we can get it, absolutely. If it is the cup of joe that's keeping you awake at night, though, there is a new